Madam, calls to regulate mental health providers are not new, and I recently did so in early 2024. Such professionals include psychologists, therapists, and counsellors, the roles and work of whom many lay people struggle to grasp. Concerns that the shortage of professionals will be exacerbated by introducing regulation have to be balanced against the real potential harm to already vulnerable clients seeking support from inadequately trained individuals purporting to provide therapy and the like. Just last week, worrying reports emerged about unqualified individuals offering counselling services on platforms like Carousell. Regulating this area also means that clients seeking help know that a professional has met a baseline level of training and understanding of the often challenging ethical concerns that arise. It is also a first step for our existing healthcare financing to be used to expand access to such services. I therefore hope that the Ministry will develop a long-term plan to regulate the industry, taking into account the views of professional bodies, while keeping an eye to make sure that barriers to entry are not overtly high. A key part of this is to work with training providers and to increase the supply of qualified professionals to ensure that Singaporeans' mental health needs are adequately and safely met.
Sir, we have been working to register psychologists to ensure high standards of professionalism and better protect clients. The increased focus on mental health in recent years has prompted changes in psychological practice, with more psychologists now working beyond traditional clinical settings in the community and private sector. Recognizing this shift, we are working towards the registration of psychologists, focusing on psychologists who provide direct patient care, perform high-risk assessments and interventions, and whose practices may span across various sectors. An interagency implementation committee has been set up to look into this. This will raise professional standards, safeguard patient safety, and increase public confidence in psychological services. Further details will be announced at a later date.
I think SMS mentioned earlier that they're working towards registration for a subset of psychologists, if I understood him correctly. So I just wanted to check with the Minister whether there are plans, as I mentioned in my cut, to also include other mental health professionals such as psychotherapists and counsellors. Just because these are also professionals who work with vulnerable clients, and I believe that, anecdotally, some practitioners have also shared with me their concerns that there are people out there holding themselves out to be therapists after doing, some online courses or a weekend class in an area. And I think this causes a little bit of concern because, after all, the clients who come to them for help are usually pretty vulnerable individuals. And relatedly, I was just also wondering what sort of public or consumer education is being undertaken so that members of the public who are seeking help can understand, for example, what's the difference between a psychotherapist, a counsellor, a psychologist, a psychiatrist. A lot of my residents who come to me struggle to understand the difference and know where is the best place to seek help. And, and also, if they have some concerns about the person they're actually seeking, services from, where do they actually go if they've got a complaint or if they've got some concerns about some of the, you're not allowed to use the word treatment, but some of the sessions that they're having with them.
So we're early in the process. I thank Ms. Her for the questions. We are early in the process, so some of these details have not yet been established, but let me try to perhaps explain how we're thinking about this. We do indeed want to protect vulnerable individuals, and she's highlighted how someone who is seeking these sorts of services may well be in a position where they are vulnerable if not dealt with properly or dealt with by someone who's not entirely professional. So that is the perspective we're coming from. How do we protect individuals seeking these services and at the same time raise the standards and quality of the profession? So the categories of psychologists and professionals that we're likely to then want to regulate and license in a particular way are those where their risk is likely to be higher to the clients and the patients that they are treating, that they are seeing. And this, by definition, means that they are involved in issues to do with diagnosis, pathology, interventions. This is the higher risk end of the profession. So then, to her point where there are other professionals who are advertising or purporting to treat these types of problems or these types of interventions, we'll have to look and see how we craft the licensing regime and the regulatory regime as to what tools we might then have to then go after such individuals. So it's early days, but we're thinking in terms of the risks associated as a result of the professional work that someone does, the diagnosis, the risks and the interventions, as well as the vulnerability of the individual that we want to protect. Indeed, public education will be important, and we'll have to think through how we set out the naming, the nomenclature, and the details, sort of how a member of the public can choose who to go and get their therapy from, and then make available public information. The resources then for further information actually are already available. I had mentioned quite a few of them in my speech. The websites, the chat lines, and then later on this year we'll have the hotline. So a member of the public who's concerned about the therapies that they're getting can access any one of these resources or contact MOH directly, and we can also provide advice.